you. And thanks so much to Northwell for having us here today, and to Michael and to Dr. Prince. I am so proud to be with you today on behalf of the Ad Council, which for more than 80 years has built social impact campaigns to address America's most urgent issues. From Smokey Bear's iconic wildfire prevention messages, to A Mind is a Terrible Thing to Waste, to our iconic Love Has No Labels campaign, and our historic COVID-19 vaccine initiative, we have a long history of meeting people where they are to truly promote a culture of togetherness where everyone can thrive. In times of peace and times of crisis, in times of increasing hate and polarization, our mission has never wavered. At the Ad Council, we always say that we can't possibly pick a favorite campaign, just like you can't pick a favorite child. But sometimes an issue just gets inside you. You see that statistic, you see that headline, and your reaction isn't just intellectual. It's not even just emotional. It's visceral. You feel it twisting in your gut. And as a mother, you feel it in your heart. I know I'm not the only one in this room who gets that feeling. Right here, every time I see another headline about someone who lost their life to gun violence, every time there's an active shooter situation, another suicide in our communities, and 62% of Americans say they're feeling like things are headed in the wrong direction, and they tell us that they're feeling hopeless. And frustratingly, the issue of gun violence in America has a reputation for being so polarizing, so partisan, so divisive, that some people treat it as a foregone conclusion that nothing can be done. At the Ad Council, we know that simply is not true. We've learned that when we meet people where they are, when we can tell powerful human stories and inspire tangible action, even on the most complicated issues, we have the power to create change. When it comes to guns, we can all agree. None of us want to see one more child, one more veteran, one more loved one lose their life to gun violence. So what we do is both simple and profound. We start there from a place of understanding and a place of unity. The other lesson we've learned is that we can't do this alone. None of us in this room can. We bring in the most brilliant minds and resources from brands, technology, media, advertising, philanthropy, to create coalitions that will create exponential scale. Our incredible partners at Brady have done and continue to do critical work on gun violence at the policy level. And in the wake of the tragic shootings at Marjory Stoneman Douglas High School in Parkland 6 years ago, we joined forces with them on a campaign to end family fire, which focuses on preventing shootings that happen when guns are not stored safely, locked, unloaded, and away from ammunition. And we have helped gun-owning parents better understand the dangers of unsecured firearms in the home and provided resources on safe storage. We've shown people that firearm storage can prevent gun suicide in a moment of crisis, including a powerful initiative featuring veterans who sadly are at greater risk. And we've launched state-specific initiatives in Missouri and Illinois, demonstrating the power of on-the-ground work combined with narrative change to ultimately shift behavior. And we have seen real impact. 56% of US gun owners and people in gun-owning households now recognize the End Family Fire campaign. And people that are aware of the campaign are 4 times more likely to lock up their guns in a secure way. And they're 3 times more likely to have talked to their friends and family about safe storage. Meanwhile, our friends in the healthcare community have also been working tirelessly on behalf of this issue. The National Healthcare CEO Council, Northwell, and Hospitals United have leveraged their expertise and credibility to truly reframe this issue as the public health issue that it is. Last year, 157 hospitals joined forces on Northwell's It Doesn't Kill to Ask campaign to begin to shift perspective in this area. Now just imagine what we can do if we lock arms and we join forces to build on all the incredible work that's already been done, and we find new messages, new solutions, new innovations. because there still is a lot of work to be done. You heard again this morning from Michael that last year, gun injuries were the leading cause of death of children and teens from 1 to 19 for the 3rd consecutive year. There it is again, right? Gun violence prevention is not a policy issue, not anymore. It is a public health crisis, and it's time that we treat it that way. That is why we are so proud today to announce the Ad Council's new gun violence prevention initiative with $10 million in seed funding from the National Healthcare CEO Council on Gun Violence Prevention and Safety. This initial donation is the seed of a greater $40 million fundraising goal over the next 2 years to support the effort's large-scale plans to play our part in reducing firearm deaths and injuries in the United States. According to a new poll from the Ad Council Research Institute, 79% of adults in America say gun violence is one of their top concerns, but only 26% of them identified guns as the leading cause of death among children. There is a huge opportunity here for us to educate people on facts and resources, to truly normalize conversations and behavior around gun safety and save lives. And at the Ad Council, we know we are in a unique position to really convene trusted partners, issue experts, healthcare leaders, funding partners, to really create an unprecedented coalition of brilliant minds and open hearts. We're very fortunate to have some of our funders and partners from the CEO Council in the room today, some of our advisory board members, and I want to thank all of you for partnering with us on this life-saving initiative. I truly believe that everyone in America has a role to play on bending the curve on this uniquely American epidemic. Whether you're a gun owner, non-gun owner, parent, grandparents, healthcare workers, it's going to take all of us in this room and in our communities. I truly believe that we are at a tipping point. You've heard that a lot today. We at the Ad Council firmly believe that as well. When people are not willing to let gun violence continue, we need to come together and create real change, starting today, starting right now. I'm now excited and truly honored to talk more about this initiative with 2 of our lead partners and funders. I'm looking for Michael. I don't know where he is, but okay. Michael Dowling, CEO of Northwell, who has personally and passionately jumped headfirst with Northwell into this effort to be a catalyst behind this large-scale effort. And Rob Allen, CEO of Intermountain Health, who also jumped right in when the call came to really work with us to unite the country and really help save our kids. So a warm welcome for Michael and for Rob. Thank you guys so much for being here and for supporting this effort. And I know, Michael, you spent a lot of time in your opening remarks speaking to this group so eloquently and poignantly about why this issue is so important, why we're gathered here today, and why you personally have jumped in and Northwell has jumped in. Talk a little bit for us about why you formed the CEO Council and how you feel the power of the collective can make such a difference on this issue.
Well, thank you, Michelle, and let me compliment the Ad Council for the extraordinary work that you've always done. I mean, I think everybody here in the room and everybody watching virtually has been very familiar with previous campaigns by the Ad Council, including the one more recently with regard to COVID and the vaccine movement. It's an extraordinarily powerful national voice that does a wonderful communication, and I believe that continuous education is important. But your question, I have a belief that the healthcare organization leadership have a special obligation and responsibility to get beyond providing medical care on a daily basis, but to be involved in being a positive influencer in societal issues. And there is nothing more important these days, obviously, than gun violence. So I reached out a while back to a number of the CEOs around the country to see who would join. And initially, there was a very slow response, with exceptions like Rob here, et cetera. But now we have over 55, almost 60 CEOs of some of the largest health systems in the United States have come together as a coalition, as a collective, and have put their names. In fact, there was an ad I took out on the New York Times because I wanted everybody's name on the ad. I didn't want people to say, "We're with you." I wanted to say, "Are you willing to put your name on a public ad in the New York Times?" with the signature, which we did. And so I want to say, and this, by the way, goes back to one of the positives that I see that has happened, whereas there was no such council before. Now there is a National CEO Council, and many of you are here, and I want to thank you profusely. But we have a special obligation. Healthcare leaders are listened to. We have influence in our communities. We, for the most part, are the largest employers in our communities. We hire the most people in our communities. And therefore, we have to speak out about health. Gun violence is a health issue. Sustainability, climate change is a health issue. Having a good job is a health issue. It promotes health. What we do with education is a health issue. So I want to compliment the CEO Council. I think it is absolutely wonderful. It changes the dynamic. And now imagine that CEO Council and others will join, and we join with the Ad Council to do a national campaign on the issue of gun violence prevention and safety. Imagine the power of this nationally, irrespective of politics, where we send a message that this is important for you, public, to understand and continually, advertise and report and communicate and educate. There's a huge power here that we have to take advantage of, and I am delighted when we reached out to the Ad Council to get their involvement, and we have raised from the CEO Council $10 million. We need more. So anybody out there with more, we need more. Other organizations out there want to contribute to this, and other organizations want to be involved. We need to raise more, and the Ad Council, of course, once we get to a certain number, we can continue to move the agenda. But this is an important message, and I want to thank Rob here for being one of the first to put his hands up and say, I'm all in. And when you get somebody at the status of Intermountain, one of the best organizations, healthcare organizations in the country, to stand up, it sends a message. And so I want to compliment Rob for being such a wonderful partner. We worked together, by the way, very, very closely, Intermountain and Northwell, during COVID. Just as a side, just to show you how we can collaborate. During height of COVID, when we were inundated with patients, because we were at the epicenter here in New York, I reached out to Intermountain. I said to them, can you help? Because they had no COVID then. Intermountain sent us 80 staff, doctors and nurses from Intermountain, to New York to help us. My corresponding response was, when you get COVID later, we actually sent almost 70 Northwell employees to Intermountain, and we've developed a wonderful relationship. We're all in this together. It doesn't, Utah and New York are little different places, but we have a commonality of interest here. So I probably went on a little bit too long here, but I'm excited about this. That is a real power here. When you get some of the biggest organizations in the country with the biggest employee workforce, biggest influence, coming together with a powerhouse like the Ad Council, just imagine what we can do.
That was great. Thank you. And thanks for the shameless plug to invite others in.
Yeah. Anything to get more money, guys.
Absolutely. And Rob, I think, you heard Michael, talk about obviously the power of the collaborative of healthcare and building a big tent around issues that, are really scary for the American people, that they're really entrenched in, that go across party lines. And I think for us, one of the things we were most excited about when you jumped in so quickly was the ability to really sort of have another anchor partner who was going to help us jump above that political fray and really focus on the humanity and our kids. Will you talk a little bit about why you did jump in and sort of build on that narrative of why you think it's so important for us to tackle this across the country as a healthcare collective?
Yeah, thanks. Michael, thank you for the kind words, but thank you for your leadership and for being someone to convene this discussion. It is a really important discussion for us to have. And when we think about gun safety and the realities around it, it is a health issue. It's a wellness issue. It's not a political issue. My biggest worry is it gets politicized, and already has been. I think the biggest travesty during the pandemic was it became politicized instead of focused on caring for each other and the realities we were facing. And so when I think about this and our interest in joining in and why I was so anxious to be a part of it, I think of Intermountain's history. Now, Intermountain is in the interior west, 7 states. We cover about 630,000 square miles. We have urban, we have rural, we have a broad reach. And as we look at our service area, we have identified through work we do every year, or every 3 years, we do a community health needs assessment with community partners to say, what are the biggest needs so that our work is actually addressing the needs of the community. And in Utah and Nevada, 2 of our states, of our 7 states, suicide is the highest rated issue. And so we start to think about how does that play out when we look at health and wellness? And what is the relation to guns with suicide as you look at that? And the statistics are sobering. And for us, it fits our mission. Our mission is helping people live the healthiest lives possible, and we're committed to going upstream. Well, this is going upstream. This is one of the bigger issues that we need to go upstream on. And you think about who are we affecting, and it affects everybody. We've talked about that today already, but it's our kids. And if we truly want to be impactful going upstream, there's no better place to go than upstream to our kids, to the youth. How do we make it safe for them? How do we support them in their journeys? And when we looked at suicide nationally, the mechanism of suicide is 50% of suicide cases are suicide by gun, by firearm use. Well, in Utah, that number's 85%. In Nevada, suicide is the 8th leading cause of death. And so we started several years ago, before the pandemic, looking at how do we impact that? And how do we focus on safety? And how do we truly move upstream? How do we make a difference? And gun safety is a critical difference that needs to be made. And opening the discussion and having the dialogue is important. And now to be a part of a national dialogue, I think is really important. And we want to bring what we can to the table, but we also want to join with others and draw on that. And coalitions are a really important part of this work. As we started our suicide prevention work around firearms in Utah, our team, our community health team, went out and coordinated a coalition launch that was heavily focused on health professionals and gun owners to really get to the real core of the discussion of how do you truly approach safety? How do you look at changing things around us? And we learned some interesting things, and probably the most shocking data point I learned in that journey was that for children and young adults, from the point of crisis, when they reach that point of, I'm not sure I want to live anymore, I want to do something harmful, to action is less than 10 minutes. I didn't appreciate that. But it helped me understand the importance even more of creating time and distance between the moment of crisis and access to a firearm. And so in a part of the country where we are, where hunting and shooting sports are very popular, engaged by many in the populace, that means there are a lot of guns out there, how do you then have a dialogue to help people keep safe? And by the way, gun owners want to keep their children safe.
Absolutely.
And so it was a place we could have a real discussion and start a dialogue, and we saw the curve bend. We started giving out gun locks everywhere we could. We have trained 30,000 of our caregivers in suicide prevention techniques. We've provided avenues for free training to our communities in English and in Spanish around suicide prevention techniques. We've looked at drawing people together to have the real discussion and to focus on how we actually change. And those discussions are powerful and they're meaningful. And so when this opportunity came along, and I was named CEO of Intermountain Health in December of 2022, and my first question to our team when I looked at this opportunity is, why have we not signed on? Why have we not signed on? This is something we should be a part of. We're already doing things in our community, and how much more powerful can we be if we join together in that work with others and bring a national dialogue that isn't political but is health and wellness. The social determinants of health is what we at Intermountain focus heavily on. So let's have that dialogue. Let's have that discussion. And we're grateful to be a part of the journey here. And I do think this is a health issue. It's a wellness issue. It's hitting the true social determinants of health, of wellness. It's about community, and together we can make a meaningful difference.
Awesome. Well, the time police is over there.
No.
So we are.
One thing, could I have the representatives and the CEOs from the number of people that are here from the CEO Council to just stand up and be recognized?